Welcome everyone to a brand new webinar with Gem Aesthetics and Wellness. We're here to announce our brand new treatment called UltraClear. This is our virtual launch event with Kacia Bundle, Jen McElroy, and Loren Brunberg. If you have any interest in laser treatments or in skin rejuvenation, we're going to explain what this laser is all about, what it can be used for, and why you might consider it over other treatments, and why we're so excited for this new device. We also have a special promotion that we will announce at the end of the webinar. It is in addition to the promotions that we already promoted. So we'll explain how that works at the end. But before we get started, let me introduce you to our wonderful speakers. First, we have Kacia Bundle with us today. She's a board-certified nurse practitioner and the owner and medical director of Gem Aesthetics and Wellness. She's known for her natural, elevated results that blends advanced laser technology, regenerative treatments, and personalized care to help patients look and feel their best. We also have Jen McElroy with us. Jen is an experienced aesthetic nurse specializing in advanced laser and skin-focused treatments, including the BBL, Moxie, obviously UltraClear, and microneedling. She's also known for her calm clinical approach and commitment to education, safety, and natural-looking results. And finally, we have Loren Brunberg. Loren is Gem's patient care coordinator. She manages the clubhouse membership. She guides patients through skincare and treatment planning and helps with everything else that we might need. So with that, I will pass it over to you, Kacia.
Okay, great. Welcome, everybody. I am just so impressed by the turnout. Hannah was saying that it's like one of the best turnouts they've ever had. I just would like to start out by saying I am so grateful to my patients. You guys make our practice, and thank you for supporting us. Thank you for taking time to be here tonight. And we're just honestly really excited to share this new technology with you. The background story for it was about 8 months ago, started hearing about UltraClear, and I was looking for a tool to treat some things that I just didn't feel like I had a tool in my toolbox for. And in came UltraClear. I actually tried some other devices that promised the same outcomes, and the three of us, along with some of our other staff members, have tried the treatment. The three of us have had the most transformative, deeper treatments, and our results are really what made me want to share this with all of you. So let's get started, and we're gonna just watch a quick video about UltraClear.
The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs, balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
Okay, so that was just a little introduction into what UltraClear can do. A lot of things that are, one of the questions that we've gotten asked is, am I a candidate for this treatment? And the answer is everyone is a candidate, because we can tailor the treatment to you. So 4 reasons why we chose UltraClear and why patients might choose it. Number 1 is comfort. Compared to other older technologies such as CO2 or erbium YAG, patients are much more comfortable with this because of that cold pulse technology. They have much less downtime, and they heal a lot faster. 2, This can address multiple skin concerns with one treatment session. So we can layer the treatment and really address multiple things that's based on what you want for your outcome. Number 3, for some of the lighter treatments, like we'll explain and get into that 3D Miracle, these treatments are 15 minutes, no numbing needs to be applied. It's very comfortable and you have very little downtime. Number 4, we can not only treat faces, we can now treat necks, we can treat hands, we can treat scars, chests, everything on the body. So it's very versatile. The other great thing is that we can treat any skin type. So whether you're somebody with very fair skin that burns or you have more pigmented skin, we have a treatment that will work for your particular Fitzpatrick skin type. So this slide is showing a cross section of the skin and it breaks down where we would utilize these treatments. So 3D Miracle is our lightest 15-minute treatment with no downtime. And that's really working on that top layer of the skin, the stratum corneum. UltraClear is getting deeper into the dermis of the skin. And that's really gonna create more collagen remodeling. It's gonna work on some of those fine lines and wrinkles. And then at the deepest level, we're going to talk about laser coring, which is a brand new technology that is only proprietary towards UltraClear. So this is going to work on some of those more difficult areas to treat. So I love this chart because it really breaks down what each treatment can do, what the downtime is, and what kind of outcome you might be looking for. So for the most superficial treatment, the 3D Miracle, we're going to be addressing things like skin glow, some minor pigment, textural and tone. We're going to have basically no downtime with that treatment. It's safe for all skin types. With our more moderate treatments, we're going to start to get into those fine lines, deep wrinkles, maybe some acne and other scarring. But you're going to expect to have just a little bit more downtime with that treatment, so 3 to 5 days. And again, this is safe for almost all skin types. When we get to our advanced, which would include that laser coring, which we'll talk more about, if we look at this patient, she really has some of those issues that are difficult to address with things like fillers or Botox or even, you know, our Moxie BBL. She has some of that sagging of her jawline, really some of those deeper wrinkles. And for this, she's a great candidate for laser coring and the more advanced treatments. However, you have to expect you're going to have a little bit more downtime to get to this result. This slide is just showing the history of lasers. And I think this is really cool because some of these things like CO2 and erbium YAG, which are what we've had as tools to kind of achieve these results, but they are much longer healing processes. They're much more uncomfortable. Patients often have to be under anesthesia to receive them. These are 30 years old. So these are pretty old treatments. And if we look at 2018, Aclaro, the company that founded UltraClear, that's when they were started. And then the FDA approved UltraClear in 2021 for all the indications that are listed at the right. And this video is just going to show you that cool technology. So that's what we're talking about when we say a cold fiber laser. So I'll just show you a snippet of this. This is just showing those cold pulses in between the ablative laser. And those cold pulses are what makes this more comfortable and what is going to speed up your healing. I don't think we need to listen to the music. That skipped ahead. Okay, so what I'm going to show you now is actually our experience with it. So we treated some patients, and then I'll show you. Oh, things are skipping ahead. Let me go back. Okay. Okay, so we are using our new UltraClear laser today. Yay, we're so excited. And we're gonna do some coring in areas where she has a little bit of laxity. So where you start to get those nasolabial folds and marionette lines, we're gonna help tighten all that up on her. We're gonna do the UltraClear mode to help smooth some of her fine lines. So she's not even gonna need her Xeomin anymore. And
No, she
top it
will.
off with a clear just to resurface and really give her beautiful glow to her skin. So pretty.
Okay, and this next video is actually Loren receiving a treatment when we went and had one done in Great Falls with the Dollhouse and my friend Jamie Gregoris, who's a nurse practitioner there. And what I want you to note in this video, it's a very short clip, but Loren is totally comfortable. She has nothing but topical numbing cream on, and she's receiving one of the deepest treatments. So I'll play that. No, she's not. Okay. And then I wanted to share my own experience and recovery. And I will tell you, I had a pretty aggressive treatment. I did have the laser coring on my upper eyelids, which you can see that in these photos. I had it under my eyes. I had it in my smile lines and along my jawline. And the photo at the very bottom right is actually the day I went back to work. So I went back to work at day 4. I do have some pretty good tinted sunscreen on, but I don't have a ton of makeup on, and so I found that pretty doable for me. I think it's something you can do on a Thursday or a Friday and go back to work, even with these aggressive, more transformative aggressive treatments by Tuesday. So now we're just going to go through some before and afters, and we'll start with the lightest treatment. So this is 3D Miracle. This is going to be that superficial, no downtime, no numbing cream, very comfortable option that'll just give you that nice, like, healthy glow. So this is one of our patients that we did 3D Miracle on. She's never had any treatments at all, and she is 10 days post her 3-day Miracle. We just got this photo a few days ago, maybe yesterday even. And I think what you can notice is just how much brighter her skin looks. I really actually think her lines look better. So just even after a 3D Miracle, I was pretty impressed by these results. And this is not our patient, but again, I think you can just notice how much brighter and healthier her skin looks after that. She's had a reduction in some of that surface pigment. I love this one. Necks are always such a thing for patients, and you can just see how much reduction in that darkened skin pigment on her neck after one treatment. And this is only 5 weeks post. This one is slightly deeper treatment. So this is called Clear. And this is working on this really dark, stubborn brown spot this patient had. And this final photo is 4 months post 2 treatments. So again, Clear, you're not going to have a whole lot of downtime, pretty comfortable treatment, but can really address some of these super stubborn dark spots. This patient also had Clear, and what you'll notice is that her acne scars are so much improved after this treatment. Her skin is just brighter overall and healthier appearing. Okay, hands. One of my good friends is a hand surgeon, and he says that hands will always give away your age, even if your face is looking good. So I love this example on this gentleman. I think, you know, he's had 3 treatments, but I noticed an improvement in the thickness of his skin. His veins are less visible, obviously the brown spots, but you can just tell that the collagen in his skin is so much better. His hands just look like 20 years younger. Okay, so we're going to move into some of the more moderate treatments, and these are going to have just a little bit more downtime, but still more like 3 to 5 days of downtime.
And this first photo, I think, is just so impressive. This is actually from my friend Jamie at the Dollhouse, and this was a scar treatment post mastopexy. And so it was two ultra treatments, so some of the more moderate treatments going a little bit deeper into the dermis. And this is just 4 months post. So this makes me really excited about those post-surgical patients that have scarring, that we now have really like such an awesome tool to address those scars. And this is again, a moderate treatment on this patient. And so obviously you notice her pigments improved, but I think what I take away from this is that tightening in her marionette line. So I can just see her jowl, her marionette are tighter. And this is 2 months post one treatment. So what I want you guys to understand is that her results are going to continue to improve for another few months. So I would have loved to see her photos at 6 months, but we still see such a great improvement in her. And these under eye lines on this gentleman, this is just something you can't really get with Botox because they're caused from your cheek pushing up onto the eye. You can't drop a cheek with Botox, so it's really hard to treat these. We use things like PRF to help with the skin, but I think this is just such an awesome example of how you can diminish those fine lines right under the eye. And this lady, she must be thrilled with her results. I mean, this is one treatment that just blows my mind. 20 days post one treatment, improvement in her ice pick scars, pigment, but then, I mean, look at her jawline and her wrinkles around her mouth. It just is such a nice improvement for her. Okay, coming into Thanksgiving, so here comes turkey neck. All the patients want to talk about their turkey neck.
Say goodbye to turkey.
Say goodbye to turkey neck with UltraClear. So this is a moderate treatment that was done 3 times on this patient. Obviously, they have quite a lot of laxity going on here, but the results, I think, really speak for themselves. To me, this is like giving surgical results with this patient. It's pretty amazing. Scars, again, this is just something I've been wanting to be able to really treat because it can be life-changing, especially facial scars. We have a patient that she's a radiology tech and she travels, and she had her device during winter slide off of her car and hit her in the face. And it has been really, really challenging for her. So I'm excited that we have a better way to address these patients. Okay, so this is UltraClear, again, a moderate treatment. So to me, the tightening on this patient's jawline, around her mouth, those smoker's lines, and I'm pretty sure she probably had her neck done as well, because that to me looks significantly tighter. Even like I can kind of see around her eye the improvement there. Okay, so we're gonna get to laser coring. Laser coring is like it sounds. It is taking little cores of skin out and shrink wrapping things. So, so this is gonna be that deeper treatment that is gonna require some more downtime, but the results are pretty awesome. So this is gonna just show you an example of laser coring in action. Oh, go back. Sorry about that. I just wanted to say that coring is the reason that I purchased this device, because what you're going to see are the areas that are just, they're really hard to treat with what we can offer patients right now. And so this is showing that flower shape that the coring makes, and the way that it heals is so much faster, and it basically is shrink wrapping that skin and tightening things up. And there is no other device, and I have tried everything, you guys. I mean, I have tried Morpheus, I've tried the radio frequency microneedling, and this is the one that works. And working on these really difficult areas under the eyes, upper eyelids, jawline, smile lines, this is why I purchased this device. So we can see on this patient, this is one treatment of coring. And if you look at her around her mouth, under her eyes, her jawline, her neck, everything is so much tighter on her, and her fine lines and wrinkles. I mean, she looks 10 years younger than she did. This lady, I guess it could be a guy, but I mean, the results of tightening in the neck, this to me is, and this is one treatment. This is 5 months after one treatment. I mean, that to me is incredible because these are truly almost surgical-like results without surgery. Again, 6 weeks post one treatment. Look at her skin. I mean, look at her lines and wrinkles, the laxity in her neck, her jawline. This lady has to be so thrilled. She's got a jawline again. I mean, look at her cute earrings. She probably loves earrings. And this, again, these perioral lip lines or smoker's lines, patients come to me every day and talk about these, and they say, I never smoked, Kacia, like I never did this. And they're so hard to treat. And this is 6 weeks post one treatment with UltraClear laser coring. It's the same lady, again, look at the quality of her skin, her jawline, her neck, and after one treatment on her. Okay, so this is one of our treatments who did have UltraClear plus laser coring. And you can see that her under eyes they're just so much smoother, and she just has so much less of those fine lines and wrinkles there. And again, this is one of our patients that we did the full UltraClear and laser coring on, and she is, I believe, about 6 weeks post her treatment, and you can just see the improvement in that under eye area. I mean, look at her vascularity that's so much better on her cheeks, and just the quality of her skin. Her skin looks like butter now. I mean, it looks gorgeous. This again is one of our patients that we did a treatment on. She's actually only about 3 weeks post laser coring. She came in to get photos yesterday. She just gone on a run, so her skin was a little pink. But you can tell even after 3 weeks, she's starting to get some of that tightening, her less laxity in those cheek lines and smile lines. Again, this is our patient, and she was 6 weeks post, and she has a jawline again, and just the deepness of that smile line, marionette line, that's all just tightened up from that coring, and she's going to continue to see results. And we actually saw her today, and she looks incredible. This is Loren's results. She hates having her face on video, but I mean, Loren is stunning to begin with. It's hard to improve on her results, but I mean, her skin now post one treatment is just tighter, brighter, healthier. Her fine lines around her eyes are better. Those cheek lines are better. So even in somebody like Loren, we're seeing some great results. And then here's me. And I think I was also like 6 weeks post coring, and I did core above my eyes. And I was saying today to these girls, like, I just noticed I have more lash line to put makeup on. My skin quality is so much better. I have reduction in that redness and vascularity. And so even me, somebody who does a lot of treatments, takes care of my skin, I saw results with this laser, and I found it to be pretty impressive. I'm not wearing any makeup in these, and I feel like I never have to wear makeup now. Okay, so I'm going to turn this over to Loren.
Yeah, thank you all so much for coming and watching today. We're super excited. So all of our attendees, we're going to have a special for you. So we're going to have 10% off all of our UltraClear treatments but we want you to schedule a consult, and we're gonna waive that consult fee. And just really want to get you in here, and then we're going to tailor it to you because every treatment will be unique. The first people that book, first 5 will get a free skin wave. So that's awesome, and that'll be great post-treatment too. It'll really
Just
refresh,
polish you up and
yeah,
give you
look,
glow.
you'll look so glowy. So we're gonna, I believe our moderator Hannah is gonna have a link for you guys to book your consult, and we want you to book by Sunday. So we'll have that offer going until Sunday. We're just really excited. So hope you get on there and book.
And then we have one more slide. We also want to invite you to our holiday party, which is happening the Thursday after Thanksgiving. It's December 4th from 5 to 7:30 p.m. And we will be doing live demos of UltraClear. So we'd love to have you there so you can see it in action working.
Yes. Thank you all for attending. I did share the link in the chat. So if you see the chat at the bottom of the Zoom screen, you should have a link to our special scheduler. And that special scheduler is the one that will waive the $150 consultation fee. We'll also be emailing that out to you guys tomorrow with our webinar recording. So keep an eye out for that. And of course, you can always call the office and chat with Loren if you don't want to use the online scheduling.
Absolutely.
Awesome. Okay, so we have a couple of questions that came in here. You guys ready?
We're ready.
We're ready.
Okay. What makes UltraClear different from other fractional lasers like CO2 or erbium or Fraxel?
Yeah, so UltraClear's technology with that cold fiber pulsing between those hotter pulses are different from CO2. So CO2 is just a very hot ablative. That means it's like getting rid of all the surface skin, and it's targeting like all the skin, whereas UltraClear is leaving islands of healthy skin, and that's going to help you heal faster. It's going to be so much more comfortable with that cold fiber technology. And same with the coring, the way we saw that flower design. That design allows the skin to just sort of like shrink wrap back together, and it's just going to speed up your healing. So it's just a new technology. There's nothing else out there like it with the coring piece, and it's improved upon these older versions of like CO2 and erbium YAG.
Perfect. It looks like we had some issues with the chat, so I just resent the link. Please send another question in if you're not seeing the link for the scheduler. I think someone has okay, perfect. Got it. Thank you guys. All right. How customizable is UltraClear? I know we talked about this a little bit, especially in that video of you sharing what treatment you're going to provide for your patient, but can you talk a little bit more about how it's customizable for different skin types, ages, skin concerns?
Yeah, absolutely. So, I mean, some of the lighter treatments, those, are going to be great for our younger patients, for our 25-year-olds who are going out for an event and just want to have that glow back to their skin. But the truth is, like, even older patients who just want a little like light resurfacing can come in, and it's really considered like a lunchtime treatment. You don't need numbing cream. You come in, it's pretty fast. So that's great, and also safe for all skin types, including those with melasma. I know I have a lot of melasma patients, so that's a treatment that's good for you. And then really, as we get into some of the deeper treatments that include coring, that's really why we want you guys to come in for a consult. We want to tailor this to your face, because Jen's face is not like mine, is not like Loren's. And that's why I love this machine. And you said the same thing, like we can tune different settings on the device that are really going to work for what you have going on. So that's why we want you to come in for a consult, but we can work on some of those harder to treat perioral or smoker's lines, the jawline like we saw, the under eyes. I mean, I really feel like I have results similar to a bleph on my upper eyelids now because we did it up there. So yeah, so very customizable.
Okay, great. How do you decide which modes to use?
You want to answer
I
that?
would love to answer that.
I'm talking too much.
Thank you, Jen.
Yes. So you would decide on the mode that you want to use depending on what you want to treat. And so we would do the consult and listen to the patient. So if the patient has concerns about pigment, there's a mode for pigment. If their concern is perioral, deep lines, there's a mode for that. If there's someone that wants to get polished up for a wedding in a month and this is what they need. So it would just depend on the patient's concerns and
Their timeline,
how much time do they want to be down? Like they will be very educated on what treatment we feel is best and what that treatment looks like post-treatment. The treatment part is the easy part. Then it's the 2 or 3 or 4 days following that they really need to be prepared for. They'll be sent home with a post-care kit that has all of the balms and washes and all the things for a really successful recovery.
Yep.
Wonderful. So you guys are also providing aftercare kits to go
Aftercare.
along with every procedure.
Yes.
Wow.
All the patients will go home with an aftercare kit, and that's just a part of making sure that they have a really great recovery.
Perfect. Awesome. What surprised you the most about using UltraClear once you started?
I would say how comfortable it was.
Yeah.
I mean, as a patient, it was a lot more comfortable than I expected, and quick. And as a provider doing the UltraClear, it was actually pretty easy to do technique-wise, comfortable. The laser itself is comfortable. Patients were comfortable. I would say the comfort, the downtime was actually not as long as I expected either.
Yeah, I would say, I think like one of the biggest surprises is with these deeper treatments, how quickly our patients are healing. So we've been doing these treatments now for on patients, and since August we've been doing treatments, and so we've been able to see how our patients progress, and it's really just impressive to see how quickly, day by day, their day by day photos, sort of like what we shared with me, how quickly they're healing, even with the more deeper transformative treatments.
Agreed. It's pretty incredible, the results that we're seeing so quickly. And then you have continued results with the collagen remodeling that you're going to see based on the way the laser works. We do have a question here about pricing. Someone would like to know what the price range is like and how it's comparable to BBL Moxie.
Good question.
You want to do that?
Sure. The more lighter 3D Miracle, that's going to start around 800, and then depending on your treatment, it's just going to go up from there. That's one of the beauties of it, is it's just very customizable. So we want to see you come in, and then we can really accurately give you a quote. But you'd say starting around 800, and then it will just go up from
Depending
there.
on what
Yeah,
the patient's goals and how deep the treatment is and all of that.
And it's so hard to provide a solid number without seeing someone, because like that video, like we've talked about, Kacia's doing different levels on different parts of the face. So we're creating something special for you.
Very individual. Yes.
Okay, perfect. The last question we have here is, do you have any age recommendations to starting UltraClear or starting at various modes of UltraClear?
I would say, they even showed the little kid with the scar. I mean, I really think it can be used on all ages. It just is, again, very individualized. It depends what you want to address, what you're comfortable with, how much downtime you want to deal with, and then ultimately like what your outcome is.
I feel like the younger patient would be more preventative and rejuvenation, whereas the older skin that's matured a little bit be more treatment mode. So a consult obviously is where you find if you're a candidate for this, but a young person would definitely benefit from
like building that collagen when you're young. I mean, as you leave your 20s, you're starting to lose your collagen. So definitely that like prejuvenation prevention, like building the collagen is great.
And pigment reduction.
We got another question in. Is it safe to use while breastfeeding or nursing?
I would say breastfeeding is one of those things that we always have patients clear with their pediatrician.
Mm-hmm.
For 3D, for 3D Miracle, because there's no numbing cream. I mean, that's really like usually the issue with breastfeeding is because the numbing cream can get into the breast milk. And so we don't, like, patients still do BBL and Moxie, but we just get it cleared with their pediatrician if they're breastfeeding. But great question.
Yeah, I think that's a great question too. And I also nursed my babies and I felt like I had a lot more melasma still coming through. So I just waited till I was all done so I could get it all fixed.
Right. Yeah.
Okay, perfect. Another question, preference on using Moxie or UltraClear for melasma. I know you had a lot of specifications, Kacia and Jen, of what you wanted to use each device for. Can you share a little bit more about that?
Yeah, I mean, honestly, Moxie is still my go-to for melasma. I just have such a great protocol with it. I do think that I think that each thing is a tool in our office, and I kind of know and able to direct the patients into what I think they're going to get the best outcome with. We're never going to get rid of BBL and Moxie. BBL, because of the Stanford study, we know that 3 treatments a year help your skin reverse age at the cellular level. I'm still going to get my 3 BBLs a year. And Moxie is, I just get such great results with melasma and Moxie patients. So that's going to continue to be my go-to with melasma. I will say
Rosacea too.
Rosacea, not so much Moxie, but BBL.
Yeah.
BBL is for sure with rosacea, but we are getting great results for some of that vascularity with UltraClear. And I tell patients, recovery from Moxie is probably going to be like a step down from the 3D Miracle. So this device is just kind of a step up from our Moxie. And it truly is, because my Moxie is a 1927 nanometer, whereas this device is a step up in terms of where it's going into the skin. So I think 3D Miracle has maybe a little bit more downtime than Moxie for some patients, but we're able to just address different things in the skin with it.
Okay, perfect. I don't have any other questions, so I want to thank the 3 of you for being on the webinar tonight. I want to thank everyone, all of our wonderful attendees, for joining, for asking these great questions. Don't forget to schedule your appointment. So you can schedule your consultation with the $150 waived consult fee only until Sunday night. So you want to grab that link now, at least open that in your phone, text it to yourself if you need a minute to schedule. We'll also be sending out an email tomorrow, and I can send you an SMS as well just to make sure you have it. And we'll hopefully see you guys soon, and hopefully see you at the holiday party.
Yes, we'd love to see you guys here. It's a really fun night.
All right. Thanks, everyone. Have a great night. Bye.